It's me, AG, and today I want to talk to my nurses. Okay, I want to talk to the nurses about something that is extremely near and dear to my heart. Okay, if you kind of read the description about what today's topic is going to be about, you already know that I want to talk to you about the fact that somebody needs you. And I already said that it's not going to be who you think it is. We already know that our patients need us, okay? Our patients need us to explain things that they don't quite understand. Maybe the doctor came in and explained something to them in medical terminology and they don't understand what these words mean. They need us for that. They may need us for medication that they may need or anything else like that. We understand that. We also understand that the patient's family members need us. They need us to help them understand how to take care of their family member when they go home. They may just need somebody to sit down and talk with them about what something means. We get that. We even know that our family members need us. Our spouses, our children, they need us for certain things. Maybe your child needs you to say, okay, I'm not going to take this extra shift this week. I'm going to not do that, and I'm going to go to my kid's baseball game and be that crazy parent that sits up in the stands, and every time little kid number 23 comes out there and it's like, oh, that's my baby, you go ahead. But we know that. We know our children and our families need us. So there's a whole list of people we know that need us. But there is a set of people that need us that we don't really think about. Okay? Sometimes you don't realize how badly they need you. Okay? And that's a nursing student. Okay? The nursing student needs you. All right, so what I'm going to ask you to do is I kind of want you to go back in your mind to when you were in nursing school. Okay, do you remember what that felt like? Because a lot of times I think we forget. We forget what it's like to be the student. Okay, we're so busy being the nurse or the nursing instructor that we totally forget what it was like to be the student. Okay, so for me, I can remember this like it was yesterday. I can easily go back in my mind to the night before my first clinical. Okay, I remember this. I had the whole check sheet out, the whole checklist, and I went down the whole entire checklist, making sure that I had everything that I even remotely thought I needed for clinical. Okay, my care plan's done. I got all my medicines written out. I know my medicines. I'm ready. I've got my pen light, and I've got my stethoscope and my hemostats and my scissors, and my uniform is clean and it's crisp, and I've got already pulled out the correct color of undergarments for this white uniform. I'm good. Okay, no white panty lines showing here. We're good. Okay, so I made sure that I had everything. I was ready to go, and I woke up a few times in the middle of the night to go vomit. Okay, because I was so nervous. But there was something that I didn't have and I wasn't prepared for that I didn't even realize that I needed to be prepared for. And it happened the moment I stepped on the unit. I was not prepared for these people that I was so desperately wanting to become, these people that I wanted to emulate, these people that I wanted to learn from, to not be ready to accept me, to not be excited that I'm there, to actually very obviously be disappointed that I'm there. Not only me, my other classmates, and even my instructor. And so it really hurt my heart. It hurt my feelings to know that nurses really aren't excited about the students being in their unit, being in their space. And that's another thing that I didn't realize, is that I didn't realize, nor did I try to be in the way. If you know me personally, you know that about me, is that I want to show up. I want to do what I'm supposed to do. I want to, smile and be happy and just have fun, but do what I'm supposed to do in the same breath and not get in anybody's hair, not get in anybody's way, and leave and go home. And to just obviously know, without them ever saying it, body language is a dead giveaway, to just know that you don't want me here. you don't want me to ask you a question. You don't want me to even breathe around you. And God forbid I end up sitting in the seat you normally sit in to chart in. God forbid that. Nurses, the student needs you. They need you so bad. And what they need from you is to just be available, to just be honest, and to just be nice. Okay? Do what you're supposed to do, but be nice about it. Is that you have no idea the impact you have on the student's experience in clinical, but not only their experience in clinical, they carry that with them throughout all of nursing school. And then when it's time, they've graduated and they've taken NCLEX and they've passed, and it's time to figure out where in the world am I going to work. Do you know that they honestly carry that experience with them to that moment and determine if they're even going to work in the unit that they've had such a bad experience on? And I'll just use myself as an example. When I finished nursing school and I passed NCLEX and it was time to figure out where I was going to work, I literally had like a list. I put down all the things I love about a unit and all the things I didn't like. And do you know that the big determining factor 9 times out of 10 was the experience that I already had on their unit as a student? There were units that I literally put no by. I just automatically just cancel them off my list. It wasn't the work. It wasn't the patients. It wasn't the kind of patients we were going to be taking care of. It was the nurses. It was the experience that the nurses allowed me to have, or the experience that I allowed myself to have when I was with these nurses, that I just said, no, I'm not working on this unit because I had such a horrible experience as a student. And it wasn't because I did bad with my patient or I didn't like the kind of work that we were doing. It was literally because I felt like if the nurses felt this way about me as a student, I really don't know how they're going to feel about me as a coworker. Are they going to be willing to help me? Because the truth is that you only learn so much in nursing school. You do. You don't learn everything you need to learn when you're a student. Is that you learn the majority of what you need to know when you start working on that unit. So I want you to know that these students, they want to be you. Now, I'll be the first to admit that not all students are where they need to be. Not all students have the attitude that they need to have. I get that. We do have some students that can be an issue, but you don't even have to deal with that. You can just take that to the instructor. But I dare you. I really do. I encourage you. I challenge you that when students come on your unit, be inviting. Smile at them. Let them know, hey, thank you for coming to help us out on the unit, because the truth is that they're there to help you. They really aren't there to hinder you. They really aren't there to get in your way. The truth is that most of them try to stay as far away from you as possible because they're afraid that they're going to get in your way. I encourage you to just, if you see them, see a few of them standing around after they've kind of, done what they've needed to do. If you've got a skill that you're about to go perform, go to them and say, hey, guys, do you want to come with me? Do you want to, you want to come and watch me do this? You want to come and assist me with this? I promise you, you're going to change the outlook of at least one student if you just do that. So I encourage you the next time that you have students on your unit to just be inviting. As an instructor, it really, really hurts my heart because sometimes you get so comfortable around the instructor that you'll even say things in front of the instructor. Oh man, we got students coming today. Oh, y'all are here today. Oh. Do you know how bad, like, as an instructor, that just hurts my heart? It's like, we're here to learn, even the instructor's there to learn. Is that we're here to bring our students to learn. They want to be you. They might even one day want to work with you. And so I want you to start really thinking that when you start to realize that people don't want to work on your unit, students don't want to come to your unit when they become nurses, I really want to challenge you to think about why. Why don't we have lots of nurses wanting to flock to this unit? I really want to challenge you to think about why. It may not be the pay. It may not be the benefits. It may be you. And I really want you to think about that the next time that you have an experience with a student, is that I remember, I can hold on to some of the experiences that I had with nurses, and that it really helped me. It really encouraged me to work in an area that I was scared to even work in. And so my first job was in the NICU at Blair E. Batson Children's Hospital. I was scared to death, but it was my experience with nurses in NICU that led me to choose that job, and I wouldn't trade that experience for anything. And my preceptor, God, Key, I love you. If you're watching this, Key, oh, I love you so much. My experience with my preceptor helped me. I mean, I was just a scared little girl who had never even hardly touched a baby. And I cried when I started my first IV on a baby, and she didn't make fun of me. I mean, she was so encouraging, and it was the fact that she really just believed in me. I am so much of the nurse that I am because of the people who precepted me in my very first nursing job. So I just want you to know, nurses, the nursing student needs you. That new graduate, they need you. So smile. Say hey. Be the first to introduce yourself. Tell them you're proud of them. Tell them thank you for, adding what you add to the world of nursing. So we can all be a big difference in a nursing student's life. So just remember that. Nurses, the student needs you. Okay, that's all I got for you guys today. So just remember, I want to know what you think. I want to know what your feelings are on about the fact that the nursing students need you. Make sure you comment on this video, and always, if you got questions, if you got comments, if you just want to say, hey, what's up, girl, hit me up on ag@nursingforall.com. Peace out, players.